Hello and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make getting healthcare effortless and bring you insights from Vietnam's top players in healthcare. On this week's episode, we're speaking with Dr. Tran Thinh, a dermatologist working at his private practice in Ho Chi Minh City. Prior to starting his own clinic, he was in charge of the Ho Chi Minh City Department of Health's Sexually Transmitted Disease and HIV Infection Control Program. And he was also the head of clinical dermatology at the Ho Chi Minh City Dermatology Hospital, which is a really big public hospital here. He has over 38 years of specialized experience practicing in dermatology. And so it is so great to have such an experienced doctor here on the podcast with us today. Welcome, Dr. Thinh. Also, I think in the 1990s, the HIV/AIDS epidemic was very scary as well, right? People then didn't have the full treatment options that they do now. And so after you finished your studies in San Francisco, you learned all about epidemiology, these kind of new technologies using computers to do that. What did you bring back to Vietnam from that?
A lot. I think the first thing that I can speak to our friends, that I can do some solution for calculation of statistic for prediction of HIV/AIDS situation in Vietnam, in Ho Chi Minh City at that time.
Wow. So were you one of the first epidemiologists in Ho Chi Minh City?
Yes, maybe at that time I have some small study HIV/AIDS among IDU, that means intravenous drug user. IDUs, and at that time I reported that the rate of infected people among normal people 40%, because they use the same needle to inject the drug.
Oh my God. So 40% drug users in Vietnam at that time had HIV.
In Ho Chi Minh, not in Vietnam. But at that time, many young people, and especially the sex workers, they like to use the drug because at that time, heroin is too expensive for people. And they use the opium. And at first, they use opium to smoke. But later on, it's not good enough for them. And so they change to drug user injecting. And so that's why they don't know how to avoid the infection. And they use the same needle from person to another person. And so they transmitted HIV with large, very high rate among IDUs. And at that time, the sex workers in Ho Chi Minh City, they would like to use the drug, and low income. They don't have money to use heroin, for example. They use opium. And so it's the time for people to worry about the high situation, the high rate of infection.
It's so scary. And so what are some of the things that you did while you were the head of the government department then to stop the spread of HIV in Ho Chi Minh City?
At that time, at the beginning, I worked as a dermatologist, not as specializing. And so I talked to my boss, my higher level official, that is very strange for a dermatologist to learn how to prevent AIDS. And so they said that because you would like myself, I would like to go abroad. It's very proud for us. And now you come to San Francisco and go many places in San Francisco to learn about IDUs, the sex workers. And so you can continue. And my boss said that he would like to see some projects from foreigners to pay attention to the situation. And after that, you maybe become a specialist in HIV/AIDS prevention. Especially, you know that STD and HIV linked together. And so if you know the way to prevent STD among people, you know the way to prevent the HIV transmission from people. Especially, I would like to learn about HIV transmission from mother to child, because it's very terrible for them. There are sex workers Now they get pregnant, and it's very emotional if they get infection of HIV, and they can transmit HIV to the child, to children. And so at that time, we have a dream to have ARV drugs, ARV medicines to treat for prevention mother-to-child transmission. And so it's very emotional, especially after that I came to Thailand, because Thailand at that time is the source for us to learn, because they do many things for HIV transmission among the sex workers in Thailand, among mother-to-child transmission. And so it's very interesting for me.
And so now I guess it's quite different from in the 1990s with how modern, Ho Chi Minh City has become. So what are typical issues that you see in dermatology in Vietnam today?
Today? In the past, I don't like to join dermatology, because that time my professor and experienced physician, they don't like dermatology. Because at that time, everybody must learn leprosy.
Leprosy.
Because leprosy, they don't have good limbs, and so they have many reaction, and how to treat it is very terrible for people. Because at that time, we only have one kind of drug to treat leprosy. It's the DDS, and the way to treat is not modern. And so people don't like to learn dermatology because of leprosy.
Leprosy, wow, because it was just too sad. There wasn't good
Very
enough
sad.
treatment options. It's so interesting because nowadays too, dermatology I think is one of the most popular specialties, especially in the US. A lot of people can go into dermatology. You tend to have a nice work-life balance. You can make a lot of money in your private practice. But back then, I guess in Vietnam, the issues were so different, with all those intense infectious diseases.
Yes, I think at that time we don't think of aesthetic dermatology.
Yeah. But now there's a lot of aesthetic dermatology, right?
Yes. Now aesthetic surgery, including laser treatment, is very famous. And they organize many events like introduction of a new laser machine or new methods. For example, mesotherapy, many things. And so people together go to learn dermatology because of aesthetic dermatology, because of laser, because of aesthetic surgery. And so in the past, it's very terrible. If you come to the DV hospital at that time, 40 years or 50 years ago, 30 years ago, it's very poor hospital. And if you come to the meals, at that time, I go to DV hospital to find some lunch first. It's very poor and it's not good food for us to have a lunch. Because the environment, many hygiene is terrible because they are poor. But now it's totally different. You can come to the DV hospital, come to my old department in DV hospital. If you go to the interviews or something like that, you must pay a lot of money. For example, I just came to DV hospital for documents for the presentation of our colleagues. I must pay about $2 million. In the past, I am in charge in this duty to organize the scientific conferences free of charge. But now, if you organize one conference, for example, you can get 4, 5 billion.
Yeah. Oh my God.
It's very different from the past. So, if I would like to have some documents, I must pay. And so, the leader of the DV Houston can receive more money compared to me in the past. We organize the same situation, but people don't pay.
Yeah, just it's so different times. And then you also mentioned too that like even lasers are becoming quite popular here in Ho Chi Minh City. Do you see a lot of patients for laser treatments?
In my private practice and in DV Hospital, they organize one department for the aesthetic and laser treatment department, and they can get a lot of money. And myself, I work in my private practice. I can treat acne people, the telangiectasia, dilation of vessels, some dark color, for example, old situation, and many other. And with the high technology laser, you can get more money. For example, if I do the examination and treatment using laser, I can receive 1 million, 2 million, or 20 million, or 30 million dong for one person only. In the past, if you do the examination and the treatment using drugs, using cream, you can get only 5,000 dong.
5,000 dong. So that's like about like 20 cents versus being able to make now thousands of dollars. And people are buying these kind of like aesthetic treatments too, right? So what are your typical patients like? Are they typically high income? Or is it like middle class? Is it mostly women? Can you tell us about like who are your typical patients?
Yes. I think poor patients and rich patient is different. In the past, I can work with very low income as a practicing the dermatology. But now people don't like to work with DV hospital as prescribing the drugs, the cream, but they would like to learn laser and aesthetic surgery, because with laser, with aesthetic surgery, you can get the income much higher than the treatment for normal people, especially for leprosy, for example. Because in the past, they don't have any solution using laser or surgery for leprosy patient. But now many things have been changed. But in general, they would like to do the aesthetic surgery.
I think that's really incredible how quickly Vietnam has like changed, going from dermatology practice focusing around very serious infectious diseases, and even just the example of you being one of the first like epidemiologists to use a computer, to now you have this explosion in aesthetics in, high tech laser just in the course of 40 years. I think that's like amazing how quickly the practice can change. And so, can you talk a little bit about how do social factors like stigma or beauty standards in Vietnam that you frequently see in patients here?
Many stigma, many wrong idea for the people to practice dermatology, because they don't know exactly the cause of this disease. And so in the past, for example, they don't like to get melasma, for example, because it not good chance for people to get a dark color on your face. You cannot work to get the income because you get a melasma, or you get some skin disease or leprosy, for example.
Oh, man.
And so it's very terrible for people to get the skin disease, especially nearly the leprosy, for example.
So they're discriminated against at work.
Yeah.
So even melasma, though, it's like just so having dark spots on your face,
Yes.
the job might say no.
They don't like. They don't like to be a patient. And the doctors, the dermatologists like us, don't know how to get money from these patients. And so when we about at this up to this time, about 20 years ago, we have many new intervention. And so, for example, my practice at my private practice, we use laser. We can get a good income because we don't use the cream, the gel to apply to melasma skin. And so compared to the past, I have some older than me and friends. They are doctors. They only use the prescription and they cannot solve the problem of melasma. But now, for me, I have laser, many kinds. And so we can treat very easily. Compared to the past, it's very hard to use a cream or medicines to treat the melasma, for example. And so my friends, my old friends, now he died already. He said to me that it's very strange for you to pay attention on melasma. It's so hard to treat.
Oh, wow.
Wow, because cream, gel, etc., many things cannot solve the problem. And so, and I must prepare hydroquinone, for example. I come to the pharmaceutical department of the hospital, talk to them. In the past, we use some traditional medicines. We come to the laboratory to prepare some, we call it in Vietnam, thuốc Nam. It's like the southern medicine. And we prepare some for my study to treat the acute eczema. And so we have friends with them, with my pharmacists. And so we ask them to prepare some hydroquinone, for example. They find out the rest, the residual in the past. They cannot have some new cream. But now it's different, totally different. Because with this kind of application, cream or gel, you can have a modern cream or gel with higher price of medicine.
Well, I think that's good because it means that it's better for the patients. Like the treatments have become so much more modern. And then as a practicing doctor, it's easier to earn an income too by treating some of these aesthetic concerns. I know like in the US, it is not even a trend. It's been like this, I think, for over a decade. But it's very common for celebrities every year to get like a laser resurfacing, right? Are you seeing kind of like repeat patients that come back, frequently for the lasers to kind of prevent skin aging?
Because the price. Some poor patient, they cannot come back to my practice. But some higher level, they can come. For example, I have some young lawyer, but they get the wrong practice. Other people, they get a kind of dark color on her face. And she came to my private practice for 3 years, every 2 weeks.
Every 2 weeks? That's so frequent.
For 3 years, very strange case. And Now we have some her pictures, and it's very good because we have solved the problems. And now I have in my camera her picture. And in the past, she is a lawyer with a good income, and she come to many practice doctors. They use needle, for example, to pick on her face, many things. And at that time, she came to my private practice. She said that, I think you are old enough to treat me. And so I think sure that I can treat you. But wait, because you go so many places. And so if I do the same for the past visit, I cannot say for sure that I will treat you in good situation. But now I have friends, good friends with her, and I come to her seeing Facebook or something like that to get the picture. And compared to my computer at private practice, I can compare the past, the present, the nearly past. And so I can say that we can do some good patient for you.
That's awesome. So you had a big impact in her skin health. And so are there any new technologies that you're particularly excited about right now?
I came to many workshops introduce the new machine, like they use the UV light to establish the new machine. And they invited me to come to here. I must pay some money to come this, and it's good to go. And we can have a dream to have this kind of machine, a new technique, high technique, technology machine. And so I said to them that it's very expensive machine for me. I am now older and older. I cannot buy a machine like this. $150,000 for one machine. In the past, I have one, two is maximum. Now I have the number 3 machine. I must pay the debt. And so if in the future I have some young colleagues compare company, can have a company with me to organize a new practice. At that time, we can buy machine. And so now I have a dream. If I have a good technology machine, but we must wait for newcomers, new people, new doctors who interested on this machine. But I think I asked some people going to the conference, he or she said that 190,000, $150,000 for a machine. I already bought, and I already treat the patient using this machine, and I get the income, good income. And compared to me, she is 35 or 40 years old. I am 70 years old. And so it's different because it's the dream. We can have the dream, but it's very hard to get a reality. So I think we must do well the treatment first until some people, some doctors would like to join us to have a company to buy new machine. But in general, the information from a new high-tech machine always appear in Ho Chi Minh City environment. And so I think we can have the dream to get better than laser or another kind of laser, good machine. It is the dream. We hope we can get this.
I think that's awesome. And it just shows like how far and how much dermatology practice has changed over the years here. We've got world-class state-of-the-art machines in a lot of the clinics here. And so thank you so much for sharing about your experience with our audience, Dr. Tin. It's
Thank
absolutely
you.
fascinating. And so our listeners can book Dr. Tin at his clinic, the Tran Thinh Clinic, on Docosan, and the links will be in the description. So thanks for listening, and catch you later on Demystifying Healthcare in Vietnam.